Hello and welcome to McLaren Port Huron's Today's Health. I'm your host, Barb Winters. Our program today is all about heart valve problems. And joining us for these discussions is board-certified cardio-thoracic surgeon, Dr. James Martin. Dr. Martin, welcome back to Today's Health.
Thank you, Barb.
Can you get us started with a review of the anatomy of the heart and heart valves?
Sure. The heart basically consists of two pumps. We have a pump on the right side that pumps blood from the body to the lungs to get oxygen, and a pump on the left side that pumps blood from the lungs back to the body. There are two on each side of the heart, one valve that lets blood into the heart on that side, and another valve that lets blood out of the heart on that side. On the right side of the heart, these are called the tricuspid and pulmonic valves, and on the left side of the heart, they're called the mitral and aortic valves. Most of the time when people have problems with their heart valves, it's with the two valves on the left side of the heart, the mitral and aortic valves.
Is the structure of all of the valves the same?
The inflow valves, the tricuspid and mitral valve, are made similarly. They consist of leaflets that are tethered or attached to the heart muscle by little strings that we call chordae tendineae. On the left side of the heart, the mitral valve has two leaflets. On the right side, the tricuspid valve has three. The pulmonic and aortic valves are different from those valves, but similar to each other. They each have three leaflets, and they're called semilunar valves. They don't have any strings. They're suspended from inside the blood vessel to which they pump.
How do valves actually work?
The valves open and close by changing in pressure. So when the heart squeezes, it puts pressure on the inflow valves and they close, and it puts pressure on the inside of the outflow valves and they open. Then when the heart relaxes, the pressure in the blood vessel that the blood has just been pumped into closes the semilunar valves, and the reduction in pressure in the ventricular chambers or pumping chambers, the reduction there allows the inflow valves to open and the blood to flow in. So the blood flows in during diastole or relaxation of the heart, and then during systole or contraction of the heart, the inflow valves close and the outflow valves open.
That's amazing. It sounds really complicated. What kind of disorders or diseases are common to valves?
Well, there's any particular valve can really have two primary problems. It can either be what we call stenotic or blocked and make it harder for blood to flow through it, or it can be regurgitant or leaky, and that means that instead of the blood not going backwards through the valve, the blood will go backwards through the valve. In either event, it significantly increases the work of the heart, either to try to squeeze blood through a blocked valve or to do extra work to pump blood forward when the leaking valve is making blood flow backwards.
What kind of symptoms then would a person have if they were having some of these problems?
The number one symptom that patients with valvular heart disease get is shortness of breath, difficulty breathing, particularly at first when they're exercising or doing things. Their heart probably is working harder than normal, but it's okay when they're not doing anything. Then when the body asks the heart to work harder yet because you're climbing the stairs or carrying groceries, then suddenly the heart can't work that much harder and you start to feel short of breath.
Who's at risk for valve disease?
Well, valve disease can happen at any age, but it is more common as we get older. So the older you get, the more likelihood you have problems with your valves.
Is it a common problem like after a heart attack or something that's damaged your heart muscle, or is that completely independent?
Damage to the heart muscle can cause valvular dysfunction, but the majority of valve dysfunction is independent of heart function. So most people who develop valvular heart disease are developing it not because they've had a heart attack or they have blockage in the arteries to their heart, but because they have a problem with their valve.
Got it. Well, we're going to take a break, and then we're going to come back and we're going to talk about aortic valve disease.
Thank you.